Well, a V.B.A.C is an acronym. It stands for Vaginal Birth After Caesarean Section. Now, caesarean section rate has been increasing rapidly over the years, so it is not uncommon for 1 in every 3 women to have a previous caesarean section. Some of those caesarean sections have been performed because of reasons which are non-recurring, such as fetal distress or premature rupture of the membranes or a spontaneous episode of bleeding. These things don't necessarily have to happen in subsequent pregnancies. Some caesarean sections, on the other hand, are performed for reasons which cannot change, such as a small pelvis, a contracted pelvis, and in those women, a V.B.A.C would never be considered an option. But for women who have non-recurring reasons for their previous caesarean section, they are absolutely able to consider the option of having a vaginal birth after previous caesarean section. There are rules that apply, and I often summarize it to 3 rules. The first is that your pregnancy must be uncomplicated. So any medical problems in pregnancy that might require that you should be induced are probably reasons for performing a repeat caesarean section. The second is that you need to come into labour spontaneously, because the process of induction of labour adds a risk to a V.B.A.C and increases the risk of complications with the V.B.A.C. The use of hormone gel to soften the cervix, or the use of syntocinon infusion to augment or strengthen contractions will definitely increase the risks of a V.B.A.C. And the third requirement is that labour must progress efficiently. If we see slow progress in labour, there is almost always a reason. That reason could still be obstruction to the progress in labour, even if the patient has a normal pelvic size, because obstruction can be what we call absolute, meaning this baby in any position will never possibly fit through this pelvis. That is an automatic caesarean section. Or relative obstruction, where a baby in a particular position may not fit through the pelvis, but in another position will. In any event, if we see obstruction of any type in a V.B.A.C, that is a reason for abandoning the V.B.A.C and proceeding to an emergency caesarean section.